Hello, class. Welcome to Flourish Nursing Academy. We'll be talking about the large intestine. The large intestine is about 1.5 meters long, beginning at the cecum in the right iliac fossa and terminating at the rectum and anal canal deep in the pelvis. Its lumen is about 6.5 centimeters in diameter, larger than that of the small intestine. It forms an arch round the coiled-up small intestine. For descriptive purposes, the large intestine is divided into the cecum, colon, sigmoid colon, rectum, and anal canal. The cecum. This is the first part of the large intestine. It is a dilated region that has a blind end inferiorly and is continuous with the ascending colon superiorly. Just below the junction of the two, the ileocecal valve opens from the ileum. The vermiform appendix is a fine tube, closed at one end, that leads from the cecum. It is usually about 8 to 9 cm long and has the same structure as the walls of the large intestine, but contains more lymphoid tissue. Interior of the cecum. The colon. The colon has 4 parts which have the same structure and functions. The ascending colon. This passes upwards from the cecum to the level of the liver, where it curves acutely to the left at the hepatic flexure to become the transverse colon. The transverse colon. This is a loop of colon that extends across the abdominal cavity in front of the duodenum and the stomach to the area of the spleen, where it forms the splenic flexure and curves acutely downwards to become the descending colon. The descending colon. This passes down the left side of the abdominal cavity and then curves towards the midline. After it enters the true pelvis, it is known as the sigmoid colon. The sigmoid colon. This part describes an S-shaped curve in the pelvis that continues downwards to become the rectum. The rectum. This is a slightly dilated section of the large intestine, about 13 centimeters long. It leads from the sigmoid colon and terminates in the anal canal. The anal canal. This is a short passage, about 3.8 centimeters long in the adult, and leads from the rectum to the exterior. 2 sphincter muscles control the anus. The internal sphincter, consisting of smooth muscle, is under the control of the autonomic nervous system, and the external sphincter, formed by skeletal muscle, is under voluntary control. The structure. 4 layers of tissue described in the basic structure of the gastrointestinal tracts are present in the cecum, colon, rectum, and anal canal. The arrangement of the longitudinal muscle fibers is modified in the cecum and colon. They do not form a smooth, continuous layer of tissue, but are instead collected into 3 bands, called taniae coli, situated at regular intervals round the cecum and colon. They stop at the junction of the sigmoid colon and the rectum. As these bands of muscle tissue are slightly shorter than the total length of the cecum and colon, they give it a sacculated or puckered appearance. The longitudinal muscle fibers spread out as in the basic structure and completely surround the rectum and the anal canal. The anal sphincters are formed by thickening of the circular muscle layer. In the submucosal layer, there is more lymphoid tissue than in any other part of the alimentary tract, providing nonspecific defense against invasion by resident and other potentially harmful microbes. In the mucosal lining of the colon and the upper region of the rectum are large numbers of mucus-secreting goblet cells within simple tubular glands. They are not present beyond the junction between the rectum and the anal canal. The lining membrane of the anal canal consists of stratified squamous epithelium, with the mucous membrane, lining of the rectum above, which merges with the skin beyond the external anal sphincter. In the upper section of the anal canal, the mucous membrane is arranged in 6 to 10 vertical folds, the anal columns. Each column contains a terminal branch of the superior rectal artery and vein. Blood supply. Arterial supply is mainly by the superior and inferior mesenteric arteries. The superior mesenteric artery supplies the cecum, ascending colon, and most of the transverse colon. The inferior mesenteric artery supplies the remainder of the colon and the proximal part of the rectum. The middle and inferior rectal arteries, branches of the internal iliac arteries, supply the distal section of the rectum and the anus. Venous drainage is mainly by the superior and inferior mesenteric veins, which drain blood from the parts supplied by arteries of the same names. These veins join the splenic and gastric veins to form the portal vein. Veins draining the distal part of the rectum and the anus join the internal iliac veins, meaning that blood from this region returns directly to the inferior vena cava, bypassing the portal circulation. Functions of the large intestine, rectum, and anal canal. 1. Absorption. The contents of the ileum, which pass through the ileocecal valve into the cecum, are fluid, even though a large amount of water has been absorbed in the small intestine. In the large intestine, absorption of water by osmosis continues until the familiar semi-solid consistency of feces is achieved. Mineral salts, vitamins, and some drugs are also absorbed into the blood capillaries from the large intestine. 2. Microbial activity. The large intestine is heavily colonized by certain types of bacteria, which synthesize vitamin K and folic acid. They include Escherichia coli, Enterobacter aerogenes, Streptococcus faecalis, and Clostridium perfringens. These microbes are commensals, i.e., normally harmless in humans. However, they may become pathogenic if transferred to another part of the body, e.g., E. coli may cause cystitis if it gains access to the urinary bladder. Gases in the bowel consist of some of the constituents of air, mainly nitrogen, swallowed with food and drink, and as a feature of some anxiety states. Hydrogen, carbon dioxide, and methane are produced by bacterial fermentation of unabsorbed nutrients, especially carbohydrates. Gases pass out of the bowel as flatus, wind. Large numbers of microbes are present in the feces. 3. Mass movement. The large intestine does not exhibit peristaltic movement as in other parts of the digestive tract. Only at fairly long intervals, about twice an hour, does a wave of strong peristalsis sweep along the transverse colon, forcing its contents into the descending and sigmoid colons. This is known as mass movement, and it is often precipitated by the entry of food into the stomach. This combination of stimulus and response is called the gastrocolic reflex. 4. Defecation. Usually the rectum is empty, but when a mass movement forces the contents of the sigmoid colon into the rectum, the nerve endings in its walls are stimulated by stretch. In the eyes